So today we're going to talk about advanced directives, and this is the 5-minute Reader's Digest version of things you should know about setting up advanced directives in the state of Vermont. So some would ask why setting up an advanced directive is important. It's important because although family members or a spouse can make end-of-life decisions for you when you're unable to, it's a good idea to put in place a document that lets those people or whoever you choose to be your agent or agents know what your end-of-life wishes are, what your values in life are, and how you basically envision the end of your life going. It's estimated that about 1 in 4 people have an advanced directive, so not many people have them, but it's really important. And no matter how young you are, unfortunate illnesses and accidents can happen that may leave us unable to make decisions for ourselves. Advanced directives don't need to be co-signed by a lawyer or written by a lawyer. There are resources, and the resource we're going to go through today is the Vermont Advanced Directive for Healthcare long form, which is 9 steps that go pretty in depth if you want to go in depth, or can be pretty simple and are kind of outlined or tailored to the kind of legal requirements for an advanced directive. So advanced directives can be revoked or altered at any time. And we'll go into these step by step. So the first part of setting up an advanced directive is choosing your healthcare agent. So first of all, you can choose when your agent becomes effective. So you can make it so it's when you no longer have capacity to make decisions for yourself, immediately after signing the advanced directive, or when a certain condition is met, such as having Alzheimer's or another impairment which may kind of skew your ability to make decisions for yourself, or when an event occurs, such as being put into a nursing home or some other kind of institution that may indicate that you need assistance making healthcare decisions. Your agent is obligated to carry out your wishes. So your agent can be anyone you'd like. You can set up more than one agent if your primary is unable to carry out their duties. You can also appoint co-agents, which are multiple people who can kind of work together to make decisions for you if you're unable to. Something important to think about when appointing an agent or co-agents is making sure that these are an individual or individuals who understand your wishes and you think are capable of making tough decisions and really understanding how you feel about the end of your life. So after you appoint agents, you can appoint other people who may become involved with your care. It can be a physician, another provider, nurse, other healthcare professional. You can specify who is not to be included in your care. You can also appoint a guardian if you were to need one in the future. Part 3 is a statement of values and goals. So this basically is an opportunity to create a document to state in your own words what's most important to you in life. And there's also a section here to expand on specifics pertaining to your outlook on healthcare and healthcare decisions. Moving into section 4 and 5, this kind of delves into the specifics of end-of-life treatment wishes. You can indicate that you want all possible treatments to extend your life. You can choose specific interventions you do not want to occur, such as antibiotics, tube feeds, medications, antiarrhythmics, etc., that would help prolong your life. You can choose where you'd like to die, hospice care, dying at home. Again, part 5 goes into further detail about your end-of-life wishes, what to do if you were pregnant, what hospitals you'd like to stay at, which ones you would not like to stay at. And Section 6 is a little trickier, and this is a waive of right to request or object to treatment. So this is appointing somebody who can make decisions for you, even if you weren't able to make decisions, but you might be in a state of mind where you would be likely not to choose interventions you may perceive as painful or burden or very burdensome treatments, and this would be a person who can kind of think clearly and do the right thing for you. There's options here to allow studies on you or student education while you may not be able to think and make decisions for yourself. Section 6, by the way, needs to be acknowledged by a clinician and acknowledged by the agent, and it needs to be overseen by a member of the clergy, attorney, probate court designee, or an ombudsman. Section 7, organ tissue and donation. So that can specify whether you want to donate to your organs or tissues. And then Part 8 indicates your wishes for disposition of your body after your death. And Section 9 is a signed declaration of wishes, which needs to be acknowledged by two witnesses that you in fact understand what you're signing and are thinking clearly. So as you can see, this is a very brief Reader's Digest version, but advance directives are very important to have in place to make sure that things do not happen to you at the end of life you don't wish to happen, and you die with dignity, and if you are unable to do so, make decisions for yourself.